Hi you guys, how are you? Jennifer here, and I wanted to do a quick video because my family's gonna get home in just a few minutes, and so I've only got a little bit of time to do this video. That's why I'm like in this location. I don't want to have to set up anything, but I want to do a quick video because I want it, well, it's really fresh in my mind. I want to talk to you guys about, today I had to get a barium swallow. Now, a lot of us call it a leak test. I didn't do it for a leak test. I did it as the upper, it's called an upper GI, but I'm 3 years post-op, and so I had a little bit of a different experience, but because I had vertical sleeve gastrectomy 3 years ago, I still have a tiny little tummy, and so it was my very first one, and I had looked on videos, and you know, a lot of people talked about the actual barium taste, but they didn't actually talk about the whole procedure. So while it's really fresh in my mind, I wanted to kind of describe what I experienced so that in case you are going to have to get one, or you might be worried about it, then you kind of know what to expect, because I really didn't know too much what to expect, and having something like this would have been helpful. So let me just get right to it. I got in, I did have to change my clothes, so I'm literally like right now, I like walked in the door from my house like 2 minutes ago, but I had to change. I had to put on a gown, left my panties on, and that was it. Had to take off my look, I don't even have my earrings back on or my necklace. No jewelry except for rings on your hands is fine. But yeah, just panties. You have to take everything else off, and socks. I kept my socks on. Socks and panties was it, and then like a gown. I went into the x-ray. It's the same area that you do like your normal x-rays. And what they did for me is they did like one lane flat of my belly, and they called it a before shot. That way they would have like a comparison. So they did that one. It was just like a regular x-ray, as if you had broken your arm or your knee or your hip, or you know, whatever the case. It was a normal x-ray. And then I kind of had to sit down for a couple minutes because it's actually a doctor that comes in and performed the actual upper GI test. So there was a technician and a actual doctor. So the doctor came in, and they had moved the bed to an upright position. So I stepped up onto the the bed part, but I was in an upright, but I was leaning against it, and they pulled around the whole machine. So the x-ray part was now in the front of me, and they had this thing. So I had seen in some other videos, some people talked about having to take a little tablet. It's sort of like an Alka-Seltzer-y thing that's supposed to like inflate the stomach. But as a weight loss surgery patient, I was pretty worried about that because my stomach is so small that I was concerned about it. And rightfully so, I might add, because I mentioned it to the doctor, or I told the doctor, you know, I've had surgery. Are you sure I should be taking the full dose of this stuff? And what they have at where I was, it was probably, here's like a little container, kind of hard to see, I know, but it was probably like half full, like this big, of this white powdery substance, and then they had a little cup of water. And then what the technician did is he handed me the cup. So I held the cup with the powder, and then he poured the water into it, and then I was supposed to drink it like a shot. Well, I took the full shot just like a regular person would. There was no variation for me being a weight loss patient. Holy smokes. I don't know if they have much experience with doing this with people that have had weight loss surgery, but it was so terribly uncomfortable. I wouldn't necessarily call it like debilitating pain, but the pressure, I mean, oh, it was so bad that I was just like, oh my God, give me a minute. And I was like, I'm seriously, I'm gonna throw up. And so I'm like, I need like something to throw up in. So they got me something, and what they did is they had me sort of like, because she was still going forward. I mean, the doctor was very nice, but she wasn't very sympathetic. And so she was just like, okay, so you're gonna have to turn it at an angle, kind of like this. And then this here would be like the big flat part of the x-ray machine. And so they handed me this cup of this barium. I've heard that sometimes places have like flavored barium, but it's like this white, thick, chalky drink thing, and it had a straw. And so, actually, no, I guess this time it didn't. The second time it had a straw, but the first time it didn't have a straw. So I was just supposed to just take these drinks of it, So she would tell me, it's like, okay, take 2 big gulps. Okay, I took baby sips because I was in so much pain. But what ended up happening, this is like so embarrassing, but I ended up just being able to like kind of burp. Even though I thought I was gonna throw up, it came out as like a burp. Oh my gosh, it did help. It made me feel a little bit better, but oh my gosh. I haven't experienced that feeling since I was like days post-op. I mean, that sort of pressure, like all the way up into my chest, and I just felt like I was gonna like explode or something. But so what she did is, so she was doing the x-rays over here. So she kept having me drink the stuff. And then I had to turn like this direction, and it was always kind of like at an angle, and I had to drink the stuff. And then what they did is they moved the bed flat again and had me go on my side. Wait, maybe I started on my right side. But then I had to drink, it was like a thinner version of the barium. But I even told them that actually the non-flavored barium, the thick stuff, it just tastes like you're drinking, like, I don't even know really how to explain it. There's not a ton of flavor. It wasn't like disgusting. It wasn't like, if you've ever had surgery and you had to do like a prep drink that makes you like flush out your system. It was nothing like that. It was not like, for me personally, it was not like gag inducing. It was not so gross that it was just like nauseating. It was just thick. And so it was just, it was so filling because, and I think I was more full from that Alka-Seltzer stuff that's supposed to like blow up my stomach, because I felt like it really was going to blow up my stomach. But anyway, so I go over, I go to this side, and then they move me to my back. But what I was going to say is that the thinner barium, it almost had like a little bit of a vanilla flavor, even though it was not sweetened, it was unflavored. It did have like a little bit of like a Premier Protein, like a protein powder drink, but vanilla flavored protein powder drink. So that wasn't as bad, and it was much easier to tolerate, but I was already so full. And then with that one, so I had to turn on each side, and then I finally had to kind of move more, like almost onto my stomach, but like at a little bit of an angle. That you actually kind of have to like swallow from a straw. But the whole process was probably only, once the doctor came in, it was probably only 10 minutes. But honestly, the very worst part was the very first minutes drinking that shot of the that Alka-Seltzer stuff that's supposed to inflate the stomach, just because they didn't make any allowance for me being a weight loss patient. And now I don't know if when you go, or if you ever have to do it, or if you've already done it, if they sort of cut the dosage. But dang, that was really uncomfortable. And right now, I actually feel very bloated in my tummy. I feel like very, very big. I've been able to eat a little bit. Oh, that's something else. You can't eat or drink from midnight the day before, like the day of your procedure, up until the test, and then after the test you can. And the doctor or the tech also warned me that like stools might be like white for like 3 days. And I told him, thank you so much for telling me that, because I would have freaked out if I saw that. But I guess it's because the barium has to kind of like work its way out of your body. I would say just knowing that it's not going to be the funnest experience, but it's not terrible. It's not horrible. At being 3 years post-op, I can't really imagine that they would give you, like if you were, a lot of people have to do a leak test after surgery. I can't imagine that they would make you do that part with the inflating the stomach. I just can't even imagine it, because I mean, you'd fall over in tears if that happened. So I would suspect that people that have just had surgery, and you can post down below if you went through this, if you had the barium swallow or the leak test, the upper GI test, post-op, like when you're still in the hospital, if you had to do that part of it, or if you just did the barium, or did you just do the thick part, or did you just do the thinned out version? Did you have to do both? I'd be very curious to know, because I am considering revision surgery, and I might be going in to the hospital again, and I would like to know what to expect for myself as well. But I wanted to share this experience with you because, Like I said, I looked at a lot of YouTube videos, and a lot of people talk about just the barium swallow part, like the swallowing the barium. And I had seen other people talk about the fact some people, you have to swallow a pill. Some people have, I didn't expect the powdery stuff. But nobody explained, you know, that fact I'd have to change my clothes, that I had to take my jewelry off, because I could have done that before I got there. So I was more prepared, so I could have been in and out a little quicker. Not that it wasn't a big deal or anything. But, and I think knowing, oh, and actually look, oh, okay, I've got my earrings and my necklace in my pocket still. I gotta put those on so I don't like lose them. But, I think knowing about how you know, you're gonna be standing up and then maybe laying down and having to kind of twist, kind of go back and forth, and then having to drink it, I think that would have helped me a little bit, because I felt very kind of unprepared when I went. Even though I knew that I'd be having to drink this chalky stuff, I really didn't know much else. So I hope that was helpful. I had VSG surgery in January 2017. I started, my highest weight ever was 261. I'm currently around 175. I had this test done because of severe Gerd and a hiatal hernia. And I'll do another video talking more about that. But I wanted to talk about this, just this one test, just to kind of get it out of the way, kind of get it posted, because yeah, it's fresh in my mind still. I'm still feeling like the discomfort in my belly. All right, you guys, I hope that helped. Hope you have a great day, great week, and I will talk to you later. Bye.